My name is Denise and I consent to this video.
Okay, so I am going to check the MAR for the order for the patient, see that they have a head to toe assessment. Then I'm going to gather all of my supplies, my stethoscope, pen light, pulse ox, and thermometer. And I'm going to go into the patient's room and we are going to start our assessment. So, use my computer, check the information. All right, so I'm going to go ahead and knock on the door. Okay, so I'm going to go in and I'm going to knock on the door.
Come in.
Hi, my name is Antoinette. I'm going to be your nurse today.
Hi.
Hi. May I have your name and date of birth?
My name is Denise Montoya, 92598.
All right, I'm going to check it against the MRN. Also, do you have any allergies?
No, ma'am.
Okay, so no allergies. I'm going to let the patient know. We're going to do a head to toe assessment today.
Okay.
All right, and so next, I'm going to go ahead and wash my hands, come back, and we will start the assessment.
All right.
All right, so I am about to wash my hands. All right, and then I'm going to use this to turn off the sink, disregard it. All right, so I am going to provide privacy for me and the patient. I am going to sanitize my hands again because I touched the curtain. If I can open it up. And I'm sanitizing my hands again because I provided privacy. And I'm going to ask the patient, do you know where we are?
I'm at Antoinette's house in Altamont Springs.
Okay. And who is present?
Trump.
Okay. So we went over the level of consciousness. So first, I want to ask her, are you feeling any pain?
No, ma'am.
Okay, so no pain. Good. Would you rate your pain on a scale to 0 to 10? 0.
Yes, ma'am.
Okay. So pain is 0. I am going to start with the vital signs. All right. So I want to go ahead and I want to clean my equipment before it touches the patient. As you guys can see, I am clearing my stethoscope. All right. And I'm going to clean my pulse oximetry. Probably should have not put the stethoscope down again, but we will handle that later. So I'm going to do that, and I'm going to go ahead and this is pre-cleaned. I'm going to go ahead and put the thermometer in her mouth. And this thermometer is taking forever. Denise is very cold. Did you drink anything just now? Okay, so that would definitely okay, so right now your temperature is a 96 right now. So she just had something cold, so that does make sense why her temperature is a little cool. We have, all All right. So her pulse ox is 99 and heart rate is 59. So heart rate is like 1 point low. That's fine. She just had water. That should explain that. Next, I'm going to go ahead and do her blood pressure. And this is a new blood pressure cuff to me, so this is going to be fun, but it's so cute. All right. And your normal blood pressure is around 120/80?
Depends what time of day, but
So it
yes.
depends what time of day? Okay. So we shall see. Let's see what happens. All right. I got 115/78. Okay. All right. So I'm going to remove the blood pressure cuff off the patient, and I am going to start basically by inspecting the patient. Her skin is normal for ethnicity. I am going to start with the top of her head. I'm going to palpate her hair, any lesions, bumps, lumps, nothing. Head is symmetrical. Hair is normal for ethnicity. There's no deviations in her hair. Since I'm back here, I'm gonna look at her neck, her skin, her shoulders. Skin is warm. She's gonna turn around and I'm gonna look at her eyebrows are symmetrical, no scaling. Eyes are symmetrical. There's no drooping. Face is symmetrical. She can smile. She can raise her eyebrows. She can stick her tongue out. She can wave it side to side. Assessing those cranial nerves. We're going to feel her ears. It's warm. Any pain? Okay. Let's go ahead and take a look. Looking at her ear, there's no excessive cerumen, no blockages. I'm going to go ahead and look at her eyes. Okay, her pupils are equal, round, and they are reactive to light. Go ahead and take a look at my pen light. We're checking for accommodation. Just follow my pen light. All right. And next, I'm going to go ahead and I'm going to palpate her lymph nodes. This is pre-auricle. There's no lumps, no raising. Post-auricle, no lumps, no raising. Going down to the jugular, in the chain, super clavicular, thyroid, swallow for me. Okay, go ahead and open your mouth, close it. Okay, assessing like TMJ, her jaw. I'm gonna also assess one carotid at a time since I'm touching her neck. Don't want her to pass out. Okay. And I'm looking because I want to make sure that I get everything. I want to look in her nose, look at the hair. It's normal, no extra coursing, no drainage. I want to look at her mouth. Inside of her mouth is pink and it's wet. And I want to take a look at her uvula. I can see the uvula. The tonsils are not touching her teeth. There's no broken teeth, nothing of that nature. And next, let's see, we did her ears, we looked at her eyes, we did her hair, we did her skin. I am going to, since I apparently just want to touch you, I'm going to check your pulses. Her skin is warm. The pulses are equal and 2+. I'm going to look at her hands. There is no discoloration in her hands. Her fingernails, they're normal shape. There's no rounding, no clubbing. I'm going to sanitize my hands because I want to go ahead and I thought about something that I forgot by looking at her. Let's see, ears. We did the ears, we did the neck, we did her pulses, we did her head, we did the skin, head, ear, eyes, nose. We did her teeth. We palpated, skin is warm. Let's see what else am I missing? And it came to me and then it left. All right, and let's go ahead and do her respiratory assessment and we will get back to that. All right. All right, so I'm cleaning my stethoscope again because I'm about to do a respiratory assessment. I'm going to listen to her lungs, make sure that she's breathing fine. Okay, ears, nose, eyes, everything symmetrical. Head, skin, lesions, no raises. All right. So while I'm in the area, first thing I'm going to do, I'm going to check to see if there are any barytes. I'm going to use the bell of my stethoscope, make sure it's on the right one, and I can hear the tap. And I am going to go ahead and listen. There are no barytes. Also, when she moves her neck, there's no jugular vein distension. I'm going to go ahead and listen to her lung spaces. Take a deep breath in every time you feel my stethoscope move. Okay. And then she's going to turn around for me and I'm going to listen to the rear lung sounds. Same thing. Every time you feel my stethoscope move, take a deep breath in. Normally, breathe out. All right, you can lean forward. Thank you. All right, everything is clear. Normal breath sounds, and I'm going to go ahead. Her back is symmetrical. She's not breathing using any accessory muscles, not having problems breathing. So I'm going to go ahead and palpate and have her take a deep breath in for me. Then we're going to have her say 99.
99. 99. 99.
For her tactile firmitis. And then going to have her turn around. Once again, her chest is symmetrical. Everything is symmetrical. No lesions, no cyanosis. Let's see. There was something else that I was looking for. I did your nails, I did your mouth, we did your eyes, we did your ears, we did your neck, we did your swallow, did your jugular, we did your teeth, we did your nails. We did the cap refill. And that's it. So I am going to, before I leave the patient, of course, if they're on a bed, I'm going to make sure it's the lowest height. Before I leave, of course, I sanitize my hands. And I'm going to go ahead and chart my findings. And that is it.